So good morning, good afternoon, good evening, everyone, wherever you are, welcome. I'm Marjorie Rollins, the Executive Director for LOINC and Health Data Standards. And we are so glad that so many of you could join us today. We were together on March 9th, exactly a year ago, for our annual meeting. But today we're going to focus our attention on the most recent release of LOINC version 2.72, that was released in February. Our plan for today is to share some highlights from the release, hear from you, answer any questions, and also talk with you about any questions you might have. So let's get started. We are thrilled that there are over 1,100 registrants from 70 different countries joining us today. This is fantastic news, and we are encouraged by your participation and your interest in LOINC. We hope the next 2 hours or so are informative and substantive for you. Next slide. It is imperative that we begin our webinar by saying thank you to all of you. Our work is not possible without you. You are on the front lines with your finger on the pulse of current events and developments in healthcare, contributing meaningful updates to LOINC that keep us current. We also extend a thank you to all of our committee members for your thoughtful deliberations. And thank you to our committee chairs and co-chairs for your guidance and leadership throughout the year. Stan Huff and Ted Klein, who co-chair the Clinical LOINC Committee, Pam Banning, Chair of Lab LOINC, Rob McClure, who chairs Document Ontology, Lisa Anderson and Randy Woodard, co-chairs of the Nursing Subcommittee, and Ken Wang, who chairs the RADLEX Committee. And special thank you to Lisa Matney, who recently served as co-chair of the Nursing Subcommittee and has retired. Susan, we appreciate your tireless commitment to LOINC and to the standards community, and we wish you well in your retirement. Next slide. Our supporters are the lifeline of LOINC. Thank you to all of our funders, donors, and members. Your continued and valued support makes the creation and maintenance of LOINC possible. We appreciate your support and commitment. Next slide. And importantly, I extend a sincere appreciation and thank you to my colleagues, the LOINC and Health Data Standards team, for the extraordinary work that they do. This is an incredibly talented team who accomplish an incredible amount of work. And thank you to Isa Hafiza, John Hook, April Lackey, David Biorto, Rita Baroni, Timothy Briscoe, Dylan Giddings, Elizabeth Lumakovska, Renee Mitchell, Felicia Owens, Jennifer Bianchi, Doug Trefun, Stephen Wagers, and Stephen Wagers. And again, this is an amazing team. And I want to extend a special thank you to Jamie Deckard, who is pictured here and contributed significantly to release 2.72. Jamie was a member of our team for 10 years and left Regenstrief last week to pursue personal endeavors, and we wish her well. Congratulations, Jamie. Next slide. So let's turn our attention to the agenda for today. Various members from our team will guide us through LOINC version 2.72 and provide updates. And what this really is a conversation on what we as a community have been working on together. We'll look at new and revised content in lab and clinical LOINC and surveys. and then get updates from our technical team on tools and features. We'll turn our attention to what's on the horizon for the coming year, including what we have planned for cross-committee engagement and our content and technical plans and other work we have scheduled for 2022. There are a few announcements. One I think you'll enjoy, and then we'll have our closing. We have built in plenty of time for questions because we want to make sure, while we want to make sure we share updates with you, we also want to hear from you, we want to listen, and we want to be responsive. And we hope you find our session today informative, useful, and interactive. Next slide. And in the spirit of being interactive, we're going to start things off with a poll to get to know you better, to gather information that is actually helpful to all of us. And we have several polls scattered throughout the webinar, and we hope you'll find them informative and useful. April Lackey is our poster for today, and I'll turn the floor over to her to share the first poll, and then our content team will be up next with some updates. April?
Yes, thank you, Marjorie. As Marjorie mentioned, we'd just like to get a little bit to know you better. So our first question is, what is the weather like today in your area? And if everyone could take a minute to share this with us, and we'll post the results, and we can all get a good idea of where we are all, whether we're warm, chilly, hot. And it looks like we are mostly not warm. So I concur with that. I am in Indianapolis, Indiana, and it is cold today. So thank you for that, everyone. And our next question is going to be, what is your professional background? What expertise are you bringing or sharing with us today from across the world? And thank you, everyone. You guys are participating so quickly. That's fantastic. Give it just a couple more seconds. All right. So we have, again, almost 90% participation. So I'll go ahead and close this question and share. And if you can see the results, we see a nice spread among technical and clinical folks. And then on my side of the fence, the administrative and operational. So welcome to you. And for all of those others, we hope that you learned something and have a takeaway from this as well. All right, and so quickly, our third question for this round of polls is going to be, is this your first webinar with LOINC? And hopefully for you seasoned linkers who are coming back to us, it's just as wonderful or maybe even better as the last one. For you new folks, well, I guess we're going to set the bar for you, aren't we? Okay, excellent. This is wonderful participation. Thank you, everyone, for doing this. We'll give it just a second more. We're close to 90% again, which is fantastic. And it looks like almost everyone has been to at least a few, and many of you have been to several. Oh, I'm sorry, I read that wrong. Many of you, this is your first, so welcome to all of you. And for those of you joining us for a second time or more, glad to have you. Okay, so those are our first set of questions. And I will now hand over to Isa Haviza, who is going to discuss our content development updates. Isa?
Thank you, April. Welcome, everybody. We are so thrilled to have you today with us on the LOINC 2.72 release webinar. First of all, I would like to thank Marjorie, our executive director. It is a pleasure to work with you every day, Marjorie. Thank you for the introduction. We are very excited that you chose to be with us today to hear and to listen to us firsthand about the content in our release. Our clinical development team spent quite a bit of time developing the content from requests submitted to answering all type of inquiries and questions, as well as supporting different type of operational strategic projects. And we have a great content to share with you, and we would like very much to talk about it in our webinar today. As you heard, this is our February release 272. It is the first release after the announcement of the new release schedule for LOINC. And we will be sharing with you some stats and counts of concepts contained in this release, and also some facts and trends that LOINC is participating in and supporting by our content development, from our content development perspective. The 272 review highlights in lab, clinical, and survey will be handled by Dr. Bawarto, by David, who will review with you more in detail the data in these domains. Next slide, please. So let's see what we have done for 2022 and look at some stats. From this slide, you can tell that we have had quite a bit of work on creating new concepts and on updating some existing concepts in LOINC. From perspective of new concept, our total statistic for that is 1,633 new, divided into laboratory 574, clinical 575 new concept, and survey 482. Updated concept, which is an important piece of maintaining the data in LOINC. The total of the statistics, as you see, it is 663 divided into laboratory, 399, while we have about 189 concept in clinical and 75 in survey. Next slide, please, April. As we know, LOINC continues its commitment to support health information exchange and semantic interoperability to ensure patient safety, to support patient outcomes, and to improve patient care at point of care. As a data standard, LOINC is always being used for reporting, data aggregation, and critical and clinical decision support systems. From this perspective, modeling new LOINC content and adding data into the database help not only just to increase data dictionary and to streamline the information across systems, but it more importantly provide a meaningful impact in multiple and various areas, like in supporting healthcare trends, in providing values to existing and revised clinical guidelines, and in keeping up with all the new decision and initiatives that are in constant development. Next slide, please. In healthcare trends, LOINC continues and makes sure to address COVID-19 pandemic, which almost moved into endemic status, by assigning priority 1 to create the related COVID-19 concept. David will be taking us on a more detailed information for what we have done in this arena. But we can share with you that we have created some new SARS-CoV-2 concepts specifically used to determine lineage and variant, as well as some new protein-specific tests. From health equity perspective, we are collaborating with various national organizations and committees, as well as international, and we are supporting national initiatives and projects to answer the need of a fast-changing market. An example for that is the HL7 Gender Harmony Project, where the new concept created helped to align with the industry equity. Healthcare trend expand also to surveys where different organizations are collecting data patient-centric for different reasons, either for research purposes to cover socioeconomic, household finances, educational impact, and various other aspects for example, like in the Charité and the Orchestra project, or collect data to provide COVID-19 related measurement protocols, questionnaires, and instruments, as in the case of the Research Triangle Institute, RTI. Also, it supports new initiatives. An example for that is the post-acute care quality reporting for CMS. We will be talking about all this in detail in later slides. Similar to these already mentioned healthcare trends, there are also more trends like in the cancer, in the area of cancer detection, organ transplant, and more in these trends. Next slide, please. Clinical guidelines translate evidence into best practice and are key metric in improving care. Release 272 includes new concept in clinical LOINC. To mention a few of those, for example, in response to requests from the CDC, the Center for Disease Control and Prevention, we added new content for testing specialized microorganisms. New concepts were created to support a technically advanced method in pathology reporting. We added also new content to support new and revised clinical guidelines, and this is in collaboration with other clinical and national associations. Very important to mention the great work that we have done with the National Kidney Foundation and the American Society of Nephrology, and that's with the support of our LOINC Laboratory Committee. We were able to add concepts in accordance with the revised clinical guidelines. These concepts are very significant and important contribution in supporting the efforts to diagnose kidney disease. Addition that we have worked in our content in other body systems related to, for example, to the cardiology system functionality with pacemakers, in ophthalmology to support the National Eyes Institute, and in neurology. Next slide, please. Modeling new concept and updating, changing, and cleaning data are very important processes that maintain the integrity and the value of our LOINC data. There are several projects in line to maintain LOINC. For example, the fixing inconsistency that we have embarked on. Well, we have remodeled the study concept and reconfigured them as orders, which expand the use of these data. Modeling and adding data in our database comes from multiple sources. There are some internal projects that we are working on. For example, the document ontology, which allowed us to add more new concept for practice and the more flexibility in the market to be able to use the clinical reportings. We have also received several submissions from national and international projects like RTI, WHO, to support the COVID-19 and other projects that are on our plate. And I have to mention that submissions and requests are also projects for private and public organizations, from hospitals, from vendors, and so forth, are very key to maintain the fast-changing market. For example, like in Mayo Clinic, EPIC, RTI, and so forth. Next slide, please. And without further, I would like to transition to David, who is going to be taking us on additional detail in the content and what we have included in the LOINC 2.72 release. Thank you so much for your attention.
Hey, thank you very much, Isa. This is David D'Orto. I'm one of the content developers on the LOINC team. I'd like to thank everyone for being here. Very excited to see the number of people from virtually every corner of the world here to see our LOINC release webinar. So, LOINC continues to grow by requests from our user community. These requests come from all sorts of organizations: government, healthcare institutions, laboratories, and companies. And interestingly, it's true that user requests for LOINC codes can often be reflective of healthcare trends, as Isa described a few slides ago. In version 2.72, LOINC terms have been added in the three major categories that you see here as colored folders: laboratory, clinical, and surveys. By clinical, we mean documents, radiology, cardiology, neurology, endocrinology, other observable concepts that are not laboratory specifically. So before drilling down into these three areas, I'd like to make a higher level observation on the next slide, please. So Isa already noted the statistics as to how many new laboratory, clinical, and survey terms were added to LOINC in version 2.72. So I'm just putting up this graphic to show that, while LOINC has been thought of primarily as a laboratory terminology for much of its existence, and that's really how it began, there is increasingly the growth of other domains of LOINC, such as the clinical and surveys. And let's look at this trend for a minute here. This bar graph shows the number of new LOINC terms for laboratory in blue, clinical in orange, and surveys in gray. And on the left, you see the most recent version of LOINC 2.72 compared to the prior 6 LOINC releases before 2.72. And this is probably the first time where the number of new clinical concepts has actually surpassed the number of new lab concepts. It's hard to say yet if that's a trend, but just looking at the one just before that, 2.71, there was also a similar pattern there. Whether this is a COVID effect or just a blip, it's hard to know. 2.71 was smaller, by the way, because it reflects that shorter release period while we adjusted and transitioned from our June, December schedule to our August, February schedule. Okay, so I'm going to drill down a little further into the details of new content added in 2.72. The goal here is not to review every new concept, but to kind of provide a brief highlight reel that in some cases could be reflective of healthcare trends, sometimes not, but we'll see all of those together. So on the left side, you see an infographic of the major additions in the laboratory domain. And we're just going to call out some examples from this listing. So let's move to the next visual. So what you see in the call out basically are the descriptions of, and what's in red in quotes are sort of just some examples. So first, let's talk about some of the details in SARS-CoV-2. So the big flood of SARS-CoV-2 LOINC code requests has abated in 2.72, as we hope the virus itself may be in the process of doing. However, in 2.72, we did continue to add new laboratory codes, and those fell into three major areas. One, for reporting distinct methods for determining lineage and variants for SARS-CoV-2. The second area was for reporting antibodies in patients, but antibodies that are specific to specific proteins of SARS-CoV-2. One example being this spike protein receptor binding domain antibodies that are neutralizing, just as an example. And thirdly, we added some additional concepts which we had begun to add prior to 2.72, but in the area of looking at T-cell mediated immunity testing for SARS-CoV-2 immunity, using the gamma interferon stimulated release by lymphocytes. So if we can have the next graphic, we're moving now to the area of additions in chemistry. So probably the most impactful addition in chemistry were the new EGFR terms for estimated glomerular filtration rate. It was a pleasure to have representatives of the National Kidney Foundation attend one of our LOINC laboratory committee calls to plan the model for the EGFR LOINC terms that are based on the new CKD-EPI equations that came out in 2021. CKD-EPI stands for Chronic Kidney Disease Epidemiology Collaboration. So there are basically two new LOINC codes, one based on an equation which uses creatinine, and the other equation is based on a creatinine plus cystatin C, and each of those has a distinct LOINC term. These two new LOINC codes can be identified by the CKD EPI 2021 indicator in the method field in LOINC. And we do provide guidance for mapping in the area of EGFR. And this guidance was drafted with the great help of our LOINC laboratory committee chaired by Pam Banning, and can be found in the user's guide under the title that you see here, choosing the correct LOINC for estimated glomerular filtration rate. Okay, great. So let's move to the next slide. Just another example, call out from chemistry. For a few years, there have been LOINC codes to report glucose on interstitial fluid, technology that's allowed for less invasive diabetes monitoring. So in the current release, we saw an additional term to support continuous glucose monitoring, technology for instantaneous glucose readings. Okay, so let's move to the next slide. We'll continue with the lab area. There were terms, a set of concepts for AI-based image analysis to support computer-assisted microscopy based on automated image analysis. The LOINC buzzword for this is computer-assisted, which you'll see in the method field. There were concepts for fire-based autopsy reporting, a whole set of those, and you can see a few examples, which I put up there, circumference of mitral valve, et cetera, things that you find in autopsies. We move to the next one. This is something that Isa alluded to as well, cancer detection. So there were several concepts added for multi-gene detection of various cancers. The concept you see here is using cell-free plasma DNA from the patient and assessing multiple genes to detect cancer in a patient, and this is perhaps reflective of upcoming trends in cancer detection. So continuing on, let's move to the next graphic. So in the area of transplant rejection, cell-free DNA and plasma is also important, and we've added several terms, a number of terms for predicting the likelihood of transplant rejection based on finding donor cell-free DNA in a transplant recipient's plasma. Okay, so now let's leave the laboratory domain in the next slide and move on to the clinical domain. Again, I'm not going to discuss all the additions that are listed in the left infographic, but I'm going to just provide some highlights. So calling out from cardiology, release 2.72 included new concepts for pacemaker variables, which was requested by the NLM, National Library of Medicine. We've already heard some about ophthalmology, but in the area of ophthalmology, there were a number of additions from the National Eye Institute, the National Library of Medicine, and the Ophthalmic Instrument Association of Japan, which are important for reporting phoropter measures. Of course, those apply to any country, including the US. And in addition, a set of concepts for reporting peritoneal dialysis parameters, also requested by the NLM. Now, as Isa noted on a slide showing a trend towards concepts supporting equity and inclusion, there's been ongoing work between LOINC and the Gender Harmony Project that's resulted in several new LOINC trial terms, including sex for clinical use and recorded sex or gender, which will be finalized as that Gender Harmony Project Committee completes recommendations this spring. And last, but certainly not least, I want to call out the area of clinical documents in which LOINC participates in concert with a very active subcommittee of volunteers, the LOINC Document Ontology Subcommittee, which is chaired by Rob McClure. And this committee discusses issues related to clinical documents and the document ontology model that LOINC maintains. So as part of that work, 2.72 saw the addition of a number of new clinical document codes, and we created a new subject matter domain in the ontology for hospice care and the corresponding document code for hospice care node. Okay, and with that, I guess we will move on to the next slide for surveys, and I'd like to reintroduce Isa to cover the survey area. Thank you.
Thank you, David. In the area of the survey, we have this is an area that is very important to support, and we have supported in LOINC. It's the highlights in the release 2.72 is the COVID-19 surveys. These are very critical to measure the socioeconomic, educational, and household finances that's impacted by COVID-19. And we can tell from the panels that we have created how type of questions and answers has been created in these panels. To list some of them is the COVID-19 health questions, the comorbidity and healthcare questionnaire, the questionnaire regarding the household finances, and last is knowledge, attitude, and avoidance behaviors. These are panels that has been created just to answer the need for the COVID-19 and its impact on the population. Another type of survey that we have also supported is actually the nursing surveys, and we have created in the 272 nursing value set for the PNDS perioperative nursing data set outcomes. In this, as you have seen on the slide, these are a concept that or type of questions, if you would like to say, that is addressing patients that they are free of injury from different exposure to different sources. One of them is, for example, the perioperative electrical source. And a similar questionnaire has been also added into that value set. Another flavor of these surveys are also a very high and very important right now these days is the SDOH, the social determinants of health. There are several instruments that we have supported in the 272. One of them is the AFPS, it's AFP, the American Academy of Family Physicians Social Needs Screening Tool and short form. That has been created to assess 5 core health-related social needs, which include housing, food, transportation, utilities, and personal needs. Another support is for the Children's Health Watch Housing Stability Vital Signs. Screens for housing, it's analyzes and screens for housing related risk. They look at the capability to pay housing, homelessness, or frequent moves in the previous 12 months. This screen is considered positive at the risk for housing instability if the patient has moved more than twice, or being homeless, or not being able to pay the mortgage or rent on time in the previous 12 months. And from the type of questionnaire, we see how impactful this type of survey is. Another survey that I would like to mention is the Health Lead Screening Toolkit. Health Lead Screening Toolkit is an inclusive tool to recognize adverse social determinants of health. It can identify patients with social and or environmental needs that may impact overall health. Next, please. I can see we are in the second slide of the survey highlights. They are also related to orthopedic surveys. For example, the Lishon knee scoring scale and the Tegner activity scale. The LKS assesses improvement post-injury or post-surgery in 8 aspects of the knee functionality. The Tegner activity scale compares the intensity of a patient's pre-knee injury activity level and the intensity of their post-knee injury. And usually these 2 scoring scales are used together. So we're able to provide that to our users. Additional one in the orthopedic area is the hip disability and osteoarthritis outcome score, and also the knee injury related outcome score. Another visual, please. For in the pain-related survey, we have created and supported the main pain staging system, which is a multi-dimensional tool developed to grade chronic pain severity and group chronic pain disorders. Also, there's the checklist from nonverbal pain indicators that evaluates 6 pain behavior in patients with cognitive impairment. So we have that pain behavior is scored from as 0 for absent or 1 for present. And these are taken during patient movement and while at rest. So you see there's the scoring of this is very helpful also in this specific staging of pain. And last but not least, as we have mentioned and alluded to before, the CMS long-term and post-acute care LTPAC assessment, we have created one assessment, but it contains 6 forms. This is due to be active in January 2023, but we are populating the data as of now for it to be ready by that time. And I think we are moving into the next slide. I think April, this is yours now. Thank you so much.
Sure. Thank you, Isa, and David. Brene, I'll ask, do we have any questions from the audience that we need to share?
No.
Excellent.
We're good.
Okay, fantastic. So that's, excuse me, tells you how well Isa and David presented all of this very, to me, dense material. So I will move on then to our next poll. This is my fun part. And I have a set of 4 questions here, and it kind of harkens to some of the content that we just heard about. So the first question is, how are you working with terminology standards? And we have several options here. Mapping, creating value sets, implementing an EHR or health systems, or other. And these are interesting response rates. Okay. I'll give it a couple more seconds. We're still getting great participation. We're at about 65% of our attendees here. All right. Just about 5 more seconds to respond. How are you working in terminology standards? Okay. And we're at about 75%, so I'll go ahead and share these results, which are mapping is the strongest lead there, implementing is second, and then other, which would be interesting if we were able to tease that out. We might do that in a future session, and also creating value sets. So thank you for sharing that. That's very interesting, I think, to all of us. So my next question is, what is your experience level with LOINC? This is one of my favorite questions, so I want to see how this turns out. I anticipate maybe we have several new folks since we had such a huge response to the This Is Your First webinar. All right. Some familiarity, know enough to be dangerous. That's where I fit in. Seasoned LOINCer. All right. And we have just about 80%. So I'll give it a couple more seconds. And I know that there is at least one person out there who can claim their experience is Clem McDonald level, and you know who you are. So I'll share these. Most folks have some familiarity or know enough to be dangerous. We have a good share of new to LOINC, so welcome again to all of you who are new. And we have some seasons. And one person responded that they are Clem McDonald level, which is the epitome of all LOINCing. So thank you for sharing that. My third question is, how many LOINCs have you requested? And we have it broken down very matrix style, so just fit in where you see yourself answering best. We have none, more than 10, more than 100, and TNTC, which was a new acronym to me. But you learn something. That's our motto. We learn and learn and learn, right? Okay. We've got some good response rates here as well. And I think we're seeing a trend here with perhaps our new folks joining us. So that is, hopefully you're getting some takeaways from this that you can share. So almost 80% have never requested a LOINC. And if you need guidance on that, shoot us a question. We'll point you in the right direction. And then we only have 5 that responded with too numerous to count, and we probably know who you are as well. So one last question in this round, and that is, do you use LOINC for answer lists? And I'm gonna guess that maybe a good portion of you aren't sure if you are new to the game here. But yes, no, not sure. All right. So again, thank you everyone for participating. It's been, we're hovering in the 70 to 85% participation rate for these polls, and so we appreciate that. It helps us get to know you a little bit better and hopefully keeps things engaging and interactive for you. So I'll go ahead and share the results of this last question. And as suspected, no or not sure really came out on top with the answer list. So that's good to know. I will stop sharing the poll, and I see that we have 2 hands up who may have questions and a possible question in the box. So Brene, can I turn over to you to field those, please?
Yes, certainly. We have a question. I think John may be our best bet for the answer. And I don't know the individual's name. Is there a way to auto-download LOINC files, such as LOINC table core, LOINC panels and forms file, or the LOINC part file? Is there any API?
Well, to be quite honest, we used to have an FTP server, which we've recently decommissioned. So at this point, unless Tim or Stephen or Dylan can tell me differently, I don't believe there is a way to automatically load the files. So if that's something people are interested in, keep shooting us requests, and we'll certainly discuss it.
Okay, thank you, John. We have 2 hands up. If those are questions that you need to ask, we ask that you try to put them into the chat. Maureen Brennan, I have allowed you to unmute if you would like to ask your questions. Maureen? Okay. So Maureen, if you could put your question into the chat, that would be great.
Looks like it was just an errant click.
Okay, sounds good. Thank you. And then we have DM042696, whomever that may be. Was that an errant question? Accidental hand raise?
That was
All
our
right.
previous question in the chat, I believe.
Excellent. Okay, so everything's been handled with that. And now we will move on to, if my slide will forward, there we go, technical development with John.
Hello, everyone. I'm John Hook, head of the technical team on LOINC. I'm just going to give a brief summary of some of the changes to the release and some of our programs. So next slide, please. So the biggest change with this release is in the number and arrangement of files we publish. We made this change so that the files be more relevant, to reduce redundancy, increase consistency, and hopefully make the downloads faster for most users. To achieve this goal, we reduced the number of possible downloads from over 20 plus files to just two files. So now we have all the data files bundled into one LOINC_2.72 zip file. And then the Relma installation is available as a separate single download, and it's no longer bundled into the large file. So if you're looking to just download the data files, the size of the download has been reduced from over 685 megabytes to just 85 megabytes. And if you are a mapper that uses the Relma tool, you can download that just as a separate download without downloading all the database files. Next slide, please. In Relma and also in SearchLoinc and throughout this release, we have included two new translations. Polish translation, which was provided by the Polish Society of Laboratory Diagnostics, and a Mexican dialect of Spanish, which was provided by Deep Dive Data Science. And I'd like to really give a big shout out to these two groups for the translators and to all of our translators. Translating LOINC is a huge job, and with each release, we have a real dedicated group of translators that work hard to translate new terms and update old terms or revised terms, and we really appreciate that work and couldn't do it without you. Another change in Relma is that after working with the HL7 attachment committee, we've decided to retire the HIPAA attachment browser widget in Relma. And in place of that, the menu option in Relma will now take you to the HIPAA attachment page on the LOINC website. And there you'll find all the latest information about the attachments. And this is just another step in our move in Relma to eliminate functionality that isn't related to mapping and get all that stuff on the website where it's available to anybody that logs into the website and does not necessitate a download and installation of the Relma program. We've also made some recent changes to SearchLoinc. These include the new Polish and Mexican dialect of Spanish translations. And we've also added some new quick queries so that you can quickly find HIPAA attachment information from SearchLoinc. And also there are some queries that are targeted at the 2.72 release specifically. Next slide, please. So April, back to you.
Sure, thanks, John. I know we have some questions coming in, so I will turn to Doug to field those to the technical team. Doug?
Let's see. So we have a question here. Any new version of the LOINC Fire server? Any plan to offer a release server?
Yeah,
the big one.
I can field that one. Yeah, we were going to talk about that in a little bit, Xavier. Yeah, we are getting very close to releasing an updated LOINC Fire server, and that's going to offer some significant new functionality. Our current server, though, does have the 2.72 codes in it, and so you can certainly access that as it is. And as far as the APIs, this next question, my understanding is their APIs are just a query, and that does not help with file downloads. Could you elaborate further? Yeah, the Fire API is strictly for querying. As I said before, when asked about a way to automatically download the files, we do not have that at this time. You can download them manually from the website. And let's see, the next question is it just a reorganization of the files and the zip files that have been available before? Yes, that is correct. Before we had things available singly in various combinations as a file that we used to call the big zip file. And there were just lots of different ways to get things, and it was causing, lots of questions and some confusion over which one should I get. So now we just streamline things. If you want the data, just download all the data. It's in that 185 megabit zip file. And if you do want the RELMA mapping program, that's just a separate file. So hopefully it simplifies your decision on which file to download. And by making that big zip file so much smaller, hopefully it'll really speed things up for you. The next question is about RELMA. Yeah, RELMA is, it's been around for an awful long time, and we're actively looking at the future of RELMA and what we should do with it. It has some real limitations. Is that for example, it's a Windows-only program, which in this day and age where, Macs have become so popular and Linux systems, that's a real limitation of the software. It's also built out of old obsolete technology. So as I mentioned before, we are actively in the process of stripping out all the non-mapping functionality and moving that to the website and kind of getting RELMA back to its core intended purpose. And then we're trying to make a decision and figure out what we should actually do with it in the future. Should we provide a mapping software in some form or fashion? Is it possible to do it in a web-based system that would save people from having to download and install a big file? And actually providing patches to RELMA is tough because the size of the program or the size of the download is strictly related to the size of the database and the indexes that are used for the searching. And so with each new release, it just makes sense to download, bundle that all together, particularly with the old technology. But again, if in the future we were to provide a web-based system, a lot of those points would just be moot. So we're exploring, and we'd love to hear your suggestions if you have any suggestions.
There's a couple more questions coming in, John. I think this is a follow-on, especially something like this. How do we use LOINC for? I use it for mapping manually. I assume that's related to the changes in RELMA.
Yeah, I'm not quite sure what the question is there, but and as far as the SNOMED, we do have SNOMED CT to LOINC mapping file available on the website, and hopefully somebody can provide the link to that in the Q&A somewhere. If you want to reach out to me, go to our website and look for the contact page, and you'll find lots of options there for contacting us. Here's a question about how do I download the Spanish version of LOINC. That's included in the data download file. If you download that file and unzip it, you'll see a subdirectory called linguistic variants, and all of the various translations are included in there. And if you go to our Search LOINC application on the web, you can set the results to be returned in whichever dialect of Spanish you would like, and just search dynamically.
Okay. Excellent. We'll give it just a moment more for any additional questions, but I think that covers all of them. Thank you, John, for all of that. And with that, we have a new question flying in. All education and training materials are listed on LOINC webpage. Do you have additional training? Everything that we have at this moment in time, we post. So everything that's on there is as accurate and up to date as we have to share. And I see Tim is typing an answer as well. Will the LOINC mapping be updated soon? Isa is tackling that question. There's a couple of follow-ups on that. And if I could put my microphone closer to my mouth, that may help. Thank you, I will do that. I've had some technical audio issues. I stole my child's headphones, so they may not be the best quality. Okay. So with that, I think we'll move to break. And we'll take 10 minutes. It's 9:01. We'll return at 9:11 Eastern. We're 10 minutes after whatever time zone you're in right now. Thank you. Welcome back, everyone. I hope everyone got a drink, a snack, a stretch, enjoyed some sort of break activity, and perhaps got some ideas on what to do. So for our next session, I will hand over to Marjorie to kick us off.
Yeah, so for this section, we're going to talk about, as the previous slide showed, what's on the, well, what this slide is showing is what's on the agenda or what's on the horizon for 2022. And we're really looking forward to sharing that with you. Next slide. So the first thing that we want to talk about is what we have planned for cross-committee engagement. And we want to have strengthen our cross-committee engagement across all of the committees, so all LOINC committees. And one reason for that is that the issues that we are addressing in data standards are becoming more complex and have a multidisciplinary focus, and for that reason, need to have multidisciplinary input. So for example, the document ontology work group has been discussing how to model gender harmony scenarios or concepts in LOINC, and those issues intersect with similar topics on the nursing subcommittee agenda. It makes sense for the two committees to have a discussion. And there are things that the RADLEX committee may discuss that the lab and clinical committees could have substantive input on. I also see our team escalating modeling and perhaps technical issues more broadly across the committees. And the goal is to realize synergy by maximizing input, which would ultimately be reflected in LOINC's content and packaging. So that's the cross-committee engagement perspective. Stay tuned for that. And now let's look at other work. I believe it is David who's up next. Is that correct? All right. David, you have the floor.
Yes.
I believe so, yes. Okay, so I'm going to get into a little bit more detail regarding work in progress and things coming up. I have to be honest that when this slide was initially conceived, we were thinking of including content for things to expect in the next release cycle. But since we've kind of reconfigured the slide to mean work in progress, there are some things not on the list that I just will mention briefly. I mean, we're working on LOINC implementation guides with the FDA that will be coming out by the end of the year, probably not at the time of 2.73, but after that. There's ongoing work, remodeling progress notes, classifying inpatient versus outpatient characteristics of notes to help distinguish clinical documents by those by the location. And there's also ongoing work with looking at modeling LOINC in ontology. So that's ongoing work that will not be in 273. Some of these things won't be as well, but let me get into some of the issues that we've listed here on this slide. So, the first version of the LOINC Top 2000 codes was produced in 2011 from data sets that were sourced from 3 large health systems. The intention was to provide LOINC mappers with a set of LOINC codes that others most commonly map their tests to as a guide for their own mapping. And there were basically 2 products that came out of the LOINC frequency top 2000 work. One was a published set of the top 2000 codes that's still available on the loinc.org website today. And the second product that came out were fields in the LOINC table that provided a rank number of that LOINC code for those 2000 codes that were included. So this first data set of the top 2000 codes came out with LOINC version 2.36 around that time, and LOINC at that point contained 65,000 roughly codes. So version 2.72, the current version, contains over 98,000 codes. So one would think that with the level of growth, the frequency of code usage most likely shifted. So the bottom line is this data needs a refresh to provide a more current snapshot of LOINC frequency of usage data, and we've been working on that. We now have recent data from multiple sources that include multi-site research databases, as well as a number of large health systems. The data that we acquired on the usage of LOINC codes is summary statistics only, so we have no patient-specific data. But apparently this data, if you add up the rows, covers over 32 billion patient records mapped to LOINC codes. So expect that a new table of the high-frequency LOINC codes will appear on the website soon for review to replace the older data. And the data in the ranking field in the LOINC database, we expect to replace with new data in an upcoming release. Keep in mind that while the first set of the top 2,000 were laboratory codes only, that the new data contains both laboratory and clinical codes. So the first bullet was primarily an implementation issue. Now on the integration side, LOINC has been working steadily to link and bind LOINC parts to appropriate corresponding concepts from other standards and external ontologies. Now the objective of this work is to take advantage of knowledge that's embedded in other ontologies to supplement LOINC by linkages and also vice versa. Taking advantages of these links, for example, you can create a model that uses, just to give an example, NCBI taxonomy to navigate LOINC microbiology concepts. Or you could link directly from a LOINC code to information in the KEBI ontology for chemicals. That stands for the chemical entities of biologic interest. To learn about chemicals being measured in a patient and mapped to a LOINC code. So continuing this ongoing work, working on the mappings to KEBI, the NCBI taxonomy, NCBI genes, gene names, variants, SNOMED, and exploring other terminologies to create linkages to is a project for the near future and ongoing. On a more mundane level, we plan to review and reconfigure some of the LOINC classes that do not serve users as well as they should, especially in the clinical domains. And finally, we talked previously about the LOINC document ontology, and we really want to up-ramp the ability to navigate and view LOINC in the context of ontological information. And we plan to start that work by providing sometime in the future upcoming an online browser for the LOINC document ontology, which currently is really viewed in table form, but the hierarchies are not navigable in that current format. So we view this as a first step in this important direction. With that, I'd like to turn it over to Isa again to discuss work in progress in operations. Thank you.
Thank you so much, David. David covered the content aspect in our work in progress. I would like to address it from perspective of operations for our content. From that perspective, we are planning on improving our internal and external processes in order to be able to respond to the big and increased amount of submission and requests from our stakeholders nationally and internationally, and also to ensure that we respond to you all in a timely manner. We are proactively working on evaluating our change management process, our submission process, both processes and everything that's included in this matter will involve some tooling, some improvement in the submission online, and that definitely is going to be in collaboration with our software team. It also involved revisiting our new current guidelines and establishing some new guidelines in our processes, because this is the best way to be able to have one channel to communicate with you, to be responsive to your needs as far as content. But we have been always in that mode, but with the technology that has been advancing, we need to be on board with that as well. From that perspective and from perspective of workflow, we're going to be asking for a few things. For example, prioritization of the request. If you have multiple requests, we're going to be asking for some references that will support the item that you are asking for, that will help establish some ground and baseline for us to go forward and to work with you on satisfying the need that you have for your business or for your operations. And also, in the same time, it will help our modelers go forward with their development work. In the same token, as much as we are looking into our internal processes and we're going to be improving technically some of these, in parallel, we're going to be communicating with you so that you won't be impacted by these changes. They're going to be ahead of time, some communication if that will have any impact, or to help streamline the information in transparency, that you won't be affected by it, and that will be able to respond to your need as fast as it can be. So we always have communicated together, and we always encourage you to communicate with us, to connect with us for any matter or any questions. So this is going to be, it is actually a work in progress, and will be always in communication about what new is going to be on the way. I believe the next slide will be John's. Thank you for your attention.
Hi, thanks again. Yeah, I'm just going to go over some of the changes we're working on the technical side. Last June's release, we announced that 4 fields were going to be deleted from our database and release structure. And when we make these kind of decisions, we always give people at least a year and 2 full releases to give them time to get prepared for the change. So you can see the 4 fields that are listed there. These are fields that we considered obsolete and weren't being properly maintained. And just to clean things up, we decided we were going to get rid of them. So for the August release, these fields will no longer be in the LOINC.csv in the realm or the access database that we provided. Any of the release files that contain the LOINC table, these fields will be missing. So if you have any scripts that count on these fields, you should start looking to get those updated before August. Another change we're going to make involves some of the scripts that we provide for importing the LOINC files. We provide scripts for importing into Oracle, Postgres, and MySQL databases. And historically, these have always just been included along with the data files in the release zip files. But unfortunately, people have been reporting more and more that their internal security systems are scanning, the files that get downloaded and flagging some of these as possible security issues. So we just decided to address the problem by pulling these scripts out of the download, and we're going to put them onto our knowledge base where people can just go there and see them and examine them and download them and use them as needed. Next slide. So in keeping with the long-term goal I mentioned about moving non-mapping functionality out of the Realma program, one of the next big things you'll be seeing is an online version of our multi-axis hierarchy browser. Here's kind of a screenshot as a teaser to get you excited. This will basically have pretty much the same functionality as the browser in Realma, but again, you'll be able to do this right from the website without having to download and install Realma. And hopefully that'll be out very soon, certainly before the August release. Next slide. Yeah, we talked about fire earlier, and hopefully again, very shortly in the near future, we'll be rolling out a new version of our fire server, and this one will include support for multiple versions of LOINC, so you can specify the particular version if you're looking for some information on an older version of a LOINC code. Currently, we're planning on backloading this new server back to version 2.69. That'll be 4 releases, and then going forward, we'll just keep adding the new versions onto that. So you'll have more and more access to old versions as time goes by. We're also adding support for translations. In fire terms, they call these designations. And so you'll be able to see those right from your fire queries. Next slide. Yeah, so here's a couple of examples of the version parameter being used in a fire query. And you'll just be able to tag on the version number to those types of queries. And then if you leave the version number off, obviously you'll get the most recent or the current version, which would be 2.7.2 in this case. Next slide. And this is just a little screenshot of what some of the translations will look like in a fire request. This is a JSON format. You can see there Chinese translation of a LOINC term. And so again, these 2 features will be coming out very shortly, fingers crossed. Next slide. Okay, April.
I know we've had some questions come in, so I'll turn to Brene to field the content related ones and Doug for the technical ones.
Thanks, April. This one goes back to David's presentation about the top 2,000. And they're asking, will the top 2,000 lab observables be US based or worldwide? Would it be possible to get separated most observed codes by country?
Okay, this is a great question. I didn't specifically indicate in my presentation, but the data that we have obtained for determining the top 1,000 is US based only. We have not sought data from international sources at this point. I think it would be difficult to obtain data by country, but it's something we could potentially look into in the future. The original top 2,000 was also based on US only data from 3 US health systems. And there was an attempt to give it an international flavor by converting some of the codes, which are in mass units, to SI unit codes, which are more commonly used internationally. But that wasn't based on any real international data that was obtained, but rather on sort of a heuristic replacement and consultation with some international LOINC users. So it wasn't actually based on real data. So we were not going to attempt to do that this time. We were going to kind of just leave it as, well, this is the data we have, it's US based. And if you use SI units, then, please consider that your replacement code is likely what you expect it to be if you're an international user. So yeah, the answer is basically no, there is no international data currently in our data set.
And next up, we've had a couple questions about the removal of the example SI unit field. I think we just want to clarify that it is specifically the example SI unit field that is being removed.
Yeah,
not
that's
the
the guy there, right?
example. Yeah, the other example units will remain.
Yeah, and actually we've combined all those fields. Anything that was in the SI units field has been moved just to the example UCOM field. And there was really no reason to have the 2 separate columns was basically the issue. It's they're units and they're all UCOM. So.
And Xavier is asking about how about new LOINC attributes in the fire server to mimic the LOINC table content?
That's a great question. We've had some discussions about that in the past, but we haven't made any final decisions. If there are any properties you'd specifically like to see, please let us know, and we'll certainly consider that. And you know, as a long-term goal, we are planning to keep expanding our fire server and provide, you know, as much data as we can through that API. So if there's anything specific you'd like to see, just drop us a line and we'll see what we can do.
Thanks, John. And we have another question with a few upvotes. Where can I find a data dictionary for all the abbreviations, i.e. test, type, and specimen type? I think it might be best if we were to send that as a link or an attachment somewhat as a post meeting resource.
I would just mention though that if you go to our knowledge base, we have a specific page for abbreviations where we list as many of them, and then I believe the LOINC Users Guide has tables and tables of abbreviations and their meanings also. So that's another good resource. And I see Andrea's comment there about some tests / LOINC units are used by both US and international units. Yeah, and that's another reason we just combined, you know, all the units into the single example UCOM units field, and they're in a delimited format in there. So they should contain both the US and the international, or mass versus substance, however you want to say it.
Up all the questions that we have at this moment. So I get to do the super fun part, the most exciting part, the part that everybody's waiting for, and make the announcement of our fall conference. We are so excited to officially announce that this will be in person. This is what we are planning. We've been planning this for 2 years, and we are finally able to move forward. Our conference is going to be hosted by Biomuro in France from October 25th to 27th. We will announce the location very soon, so be looking for that. We tentatively will have registration opened in April. And as always, we'll communicate our plans as they develop, both on our website and to emails through the user email that you register with. We are planning this to be a hybrid event with an online option, but we are very, very eager to be able to gather in person in a safe and healthy environment. So we hope to see as many of you there as we absolutely can. Which brings me to the last poll question. I had mentioned that there were 7 or 8. I've lost count now. However, our last poll question is, now knowing that we are planning this conference, are you interested in attending in person? So yes, no, maybe. It's been a labor of love for a long time coming. All right. And we're going to hit that magical 75% response rate in just a few clicks. All right. So this is very helpful for us. Again, we'd like to see as many people there as possible. There's one thing to have these webinars and have these conversations. It's a completely different thing to have them in person and to be able to truly network and see people face to face. So with that, I will end the poll, and I'm happy to share those results. And it looks like a good portion of you are going to be interested in joining, and some good chunk of maybes as well. So for those of you not interested, maybe you can meet us in the webinar portion, or hopefully learn something at some point through our website. All right. So with that, I will turn over to Marjorie.
All right, so thank you, April. And again, we do hope that everyone does join us in some way, either in person or virtually at our October conference. I want to say that this has been an incredible 2 hours or so. We've learned a lot, and we hope you have as well. We appreciate your engagement, your contribution and commitment. As you know, our mission is to facilitate information exchange, and with each release, we further execute on our mission, knowing that with each release, health information exchange is incrementally more interoperable. Some of the work is and has been, and probably always will be, incredibly challenging and at times seems impossible to achieve. But because of all of your engagement and contribution and commitment, we always make great progress. So thank you again for helping us deliver a successful LOINC version 2.72. Stay tuned for subsequent releases, and we hope to see you in October. Thank you for joining today. Have a great day.